So today we'll be studying about sternum. So can you tell me any other name for the sternum bone? So basically the sternum is known as the breastbone. Okay. So whenever we approach to the heart, like for a surgeon, whenever he or she approaches to the heart, they usually cut the sternum and like do the ribs like this and then approach towards the heart. And after that it is sutured. Okay. So this is the way to the heart. Okay. In case of surgery. So basically this bone comprises of 3 bones separately. This is a very old age bone, so that's why you cannot see the parts, but here you can see this is a fiber bone. So here you can see there are 3 parts. The upper part is known as the manubrium sterni. Okay, this is a quadrilateral bone, quadrilateral part having an anterior and a posterior surface, superior border, 2 lateral borders and 1 inferior border. Okay, then the main body of the sternum, and on the lower part there is a process known as the xiphoid process. Okay, so basically this bone is almost 7 cm long, and it is longer in case of males and a bit shorter in case of females. And this manubrium as well as the body of the sternum together in this region, they form an angle that is known as the sternal angle, and this is more prominent in case of males and less prominent in case of females. Okay, so this is the manubrium sterni, and this is the body of the sternum which is broader on the below part. Then there is xiphoid process. So the anterior surface is rough and convex, and the posterior surface is smooth and slightly concave. See, the anterior surface, it is not smooth, it is rough, as well as it is a bit convex. Okay, and the posterior surface, this is smooth and also slightly concave. Now coming to the manubrium sterni, on the upper part, this is known as the jugular notch or the suprasternal notch. You can easily palpate this like this. This is the suprasternal notch. This is our sternum. This is the suprasternal notch. And on either side, there are 2 this prominence where the clavicle attaches. Okay, so this is our clavicle. It is attaching to the manubrium sterni here, forming the sternoclavicular joint. So these are the 2 clavicle bone. Okay, sternal head of the clavicle bone. Then here this is the jugular notch, and on either side we have first costal notch. That is this one. Okay, these are the clavicular notch. This is the first costal notch. Okay, costal notch means the first rib is coming and joining with the costal cartilage, and this costal cartilage is joining with the costal notch. Okay, notch means a depression. So then there is second costal notch. The second costal notch is actually attaching, this one is actually demifacet. What do you mean by demifacet? Like this facet is, this depression is formed by the joining of 2 bones. So basically you will see here, this part, there is a notch depression which is a true facet. Here the costal cartilage will come like this, but this facet, this depression is formed by the joining of manubrium sterni with the body of the sternum. Okay, so together they form a depression where the second rib comes and attaches. If either of them is not present, then the second rib will not be attached here. Okay, so it is a demifacet. Then third costal notch up to 7th, it attaches to the body of the sternum. And 8th, 9th, 10th, 11th, 12th, these are the atypical ribs you will be studying. Okay, then coming to the muscular attachments. So on the anterior part, on almost the whole part is covered by pectoralis major muscle. Okay, so pectoralis major muscle fibers will go like this on flapping the skin of the thorax area. The first muscle that you see is the pectoralis major muscle, whose major fibers are present on the lateral halves of the sternum. And on the upper part, there is sternal head of sternocleidomastoid muscle. So why it is named sternocleidomastoid? Sternum and? Yes, cleido is there, so a bit on the clavicle, but mastoid. Where is the mastoid process? So this one is the mastoid process. Okay, this one is the mastoid process. This and can you show the sterno? Have you seen the sternocleidomastoid muscle in your body? In the neck. Okay, so this part is the sternocleidomastoid muscle. Okay, this part, this muscle is the sternocleidomastoid muscle coming and joining up to the sternum. Okay. this muscle, okay, this thick muscle. This is the sternocleidomastoid muscle coming from the mastoid process. Here is the mastoid process. From here it is coming and up to the sternal head of the sternal head of the sternocleidomastoid muscle is attaching to the manubrium sterni. Okay. So then on the posterior surface, okay, on the xiphoid process anteriorly there will be rectus abdominis muscle. So in the dissection class you will see this, there is a long muscle like this coming up to the umbilicus and crossing it. This is the rectus abdominis muscle. Rectus means long. Okay. On the posterior part of the manubrium sterni, you will see sternohyoid muscle, sternothyroid muscle, only some fibers of these muscles. And on the lower part, on the lateral surface, there is sternocostalis muscle. Okay. And on the diaphragm, on the posterior part of the xiphoid process, there are certain fibers of the diaphragm. And there is a bare area of pericardium also present here. Okay. What do you mean by pericardium? Covering of the heart. So there is a bare area of pericardium. You will also study bare area of liver. Liver bed, bare area. Bare area means like a part where there is no fascia, no fibers, nothing. Just the organ is with the help of a covering is attaching with the bone like this only. Okay, you will study this part. These are the bare areas. So this is the bare area of the pericardium. Okay, sternohyoid. Why it is called sternohyoid muscle? Hyoid bone. Okay, can you tell me any clinical significance of hyoid bone fracture? Hyoid bone fracture clinical significance. Okay, so in case of hanging and strangulation, the hyoid bone is usually fractured. So in forensic, through the fracture of the hyoid bone, you can tell whether it is a hanging case or a strangulation case. You know the difference between hanging and strangulation? Okay, hanging is self-attempted, strangulation is murder. Okay, so you can tell the difference from these only. There are certain other points also like ligature marks. In hanging, the ligature marks will be incomplete. In strangulation, it will be complete. These are other points, but the hyoid bone is usually fractured. There is abduction fracture of the hyoid bone. Like if this is the hyoid bone, these are the greater to greater cornu, this is the hyoid bone, you will see that this part will be fractured and left out. So this is a hyoid bone fracture. By seeing this, you can tell that this is hanging. Okay. And in case of strangulation, this part will be fractured inwards. So it will be adduction fracture. So in strangulation, it will be adduction fracture. In hanging, it will be abduction fracture. And similarly, sternothyroid is also there. This is the sternothyroid. So it is originating, I mean the muscle is extending from the sternum as well as up to the thyroid cartilage, not bone, thyroid cartilage. Okay, there is no thyroid bone. Now the certain relations. So on the posterior aspect of the manubrium, you have the arch of aorta as well as the left brachiocephalic vein. And on the posterior surface of the body of the sternum, you will see on either side there are pleura. Pleura means liquid filled spaces to present. Okay, okay. Pleura. Okay. How many pleura are there in the lung? Two pleura. What are they? Visceral and parietal pleura. So which one is the outer pleura? Parietal pleura. Parietal means outer. Visceral means it is attached with the viscera. Viscera means organs. Viscera means organs. The covering is the visceral pleura, and there will be some certain amount of fluid, almost 30-40 ml fluid is there, and then there is parietal pleura. Okay. So on the lateral part related to lungs and pleura, body of sternum is also related to lungs, pleura and pericardium. Xiphoid process is related to liver. Since this is up to the xiphoid process is almost up to the 7th costal cartilage, the liver extends almost from the 4th costal cartilage, 4th to 8th the liver extends almost, or up to sometimes 11th also it extends. So xiphoid process is related to liver. Now regarding ossification, so there are in total 6 ossification centers. Sometimes more ossification centers are also present. So there is one ossification center in the manubrium sterni, okay, which appears in the 5th intrauterine life. And in the sternum, body of the sternum, basically it is comprised of 4 bones. First sternebri, second sternebri, third sternebri, fourth sternebri. These 4 bones fuse together to form the body of the sternum, and this is attained up to the puberty. So it takes time, it gets completed up to puberty. So there is one ossification center in the first sternum. This is the first sternum, this is the second sternum, third sternum, fourth sternum, similar to vertebrae. Okay, in case of vertebrae they are not fused, in case of sternum they are fused and forming the body of the sternum. So one ossification center appears in the sixth in the first sternum, 7th intrauterine leaf in the second one, 8th intrauterine leaf, 9th intrauterine leaf. Okay, and in case of fusion it follows from downwards to upwards, like it is forming 6, 7, 8, 9 intrauterine leaf, but while fusing it fuses from downwards to upwards. Okay, so first this part will be fused, then this part, then this part, then this part. According to this, there are certain clinical aspects to this. So sometimes what happens, this sternum, these ossification centers, they don't get fused. So in that case, the two sternal hubs are placed apart from them. Okay. Due to this, one complication also occurs in some babies, in newborn babies. Have you heard of ectopia cordis? Ectopia. Ectopia means outside the place where it should be. For example, ectopic pregnancy, outside the place where it should be. Ectopic pregnancy means usually pregnancy takes place in the uterine cavity. Okay, if it occurs in the ovary, then not in the ovary, like in the fallopian tube, then it is ectopic pregnancy. Similar to this, there is ectopia cordis. That is, it is not present within the thoracic cage, but outside the thoracic cage. What? Cordis means heart. So you will see in certain babies, they are born with open heart. The heart is present outside the body, they are pumping blood. So this is due to like improper fusion of the sternal hubs. Okay. Similar to this, if the heart is not present out, then we call it as bifid sternum. Okay, bifid sternum. Bifid sternum means the sternal hubs have not fused together, but the heart is not out. Only the sternal hubs have not fused. Okay, this is bifid sternum. And there is another clinical aspect to this also. The sternum is usually used for bone marrow aspiration. Okay, so sometimes sternotomy is done. So bone marrow aspiration is done from the sternum because it has a cortical layer of bone. So it is easy to aspirate bone marrow cells from the sternum. Okay, with bone marrow aspiration. Aspiration means like you have seen a needle. With needle, what we do? We aspirate blood. We aspirate pus. For example, there is an abscess. Abscess means what? Sometimes you will see certain boils in the body. Boils, infection. Due to infection, there are certain bulge in the body which pains. Okay, so these are boils. So if it becomes an abscess means infection has fluid-filled cavities. Okay, so if I need to, for abscess, usually we give one cruciate incision, like we give an incision like this. Okay, and then we aspirate the fluid and we keep both the flaps like this and put a sponge or gauze inside it, and we tell the patient to come after 1 week. But in case of certain things, like in case of certain infection in the liver, we aspirate out. Aspirate means to take out the fluid. Okay, so in case of bone marrow aspiration, we take out the bone marrow content. Okay, so for bone marrow aspiration purpose, we usually use the sternum. Okay, now the xiphoid process. In the xiphoid process, the center appears by 3rd year of life. That is, it is the center is appearing after life. In all the other case, the centers are appearing before life in the mother's womb. But in case of xiphoid process, the center appears after life in the 3rd year. And it gets ossified by 40 years of age. So in your body also, the xiphoid process is not attached to the manubrium sterni. In me also. So it gets ossified by 40 years. So the fusion between the sternal plates, I have already told this, start from below upwards, begins at puberty and ends by 25 years of age. So almost by 25 years of age, the whole sternum body will be formed, and by 40 years of age, the xiphoid process will be ossified with the sternum. In certain individuals, you will see that the manubrium sterni also get fused. Usually the manubrium sterni is as it is. Okay, it doesn't get fused properly. It always stays separated from the main sternum body. But in case of extremely old age person, and that too in almost 10% of the individual, you will see that the manubrium sterni is completely fusing with the main body of the sternum. Okay, that is an exception case. So that's all in sternum. Okay.